Welcome to the Psychology and Physical Training channel, Aging and Psychological Disorders. Have you ever wondered how aging affects our mental health? It's a question that invites us to explore a profound and complex relationship. As the cogs of time continue to turn, we find ourselves navigating through the golden years, a journey that often brings along a unique set of challenges. In many societies, including India, we are witnessing a significant shift towards an aging population. This demographic change amplifies the importance of understanding the intertwining threads of aging and mental health. It's about acknowledging that the progression of age can bring forth not just physical, but also psychological changes. From changes in memory to the onset of mental health disorders, aging can cast long shadows on our mental landscape. But remember, it's not a one-size-fits-all scenario. Each individual experiences aging distinctively, painted by their unique genetic, environmental, and lifestyle factors. So, let's delve deeper into this intriguing connection between aging and mental health. Unraveling this complex tapestry may provide us with insights to foster healthier and happier golden years. Elder people in India. Let's put this into perspective by looking at the elderly population in India. The country has seen a significant uptick in its elderly populace over the past few decades. By the year 2040, it's estimated that 1 in every 5 Indians will be over the age of 60. That's an astounding 20% of the population. Now, growing old is a natural part of life, but in India, it can come with a multitude of challenges. One of these is social isolation. In a society that's rapidly modernizing and urbanizing, many older adults are left feeling disconnected and lonely. The traditional joint family system, which once provided a safety net for the elderly, is slowly disintegrating, leaving many older adults to fend for themselves. Financial instability is another significant issue. A large majority of India's elderly population is unprepared for retirement, lacking pensions or savings. This leaves them financially reliant on their families or worse, on the streets. It's a grim picture, isn't it? Then, there's the issue of access to mental health care. Despite the growing recognition of mental health issues, resources for older adults remain scarce. There's a staggering shortage of trained mental health professionals in the country, and the stigma around mental health often deters people from seeking help. What's more, various studies suggest that up to 90% of India's elderly population may be suffering from at least one mental health issue, with depression and anxiety being the most common. Yet less than 10% of these individuals receive any form of mental health care. That's a gap that we must strive to close. So you see, aging in India isn't just about dealing with physical health issues. It's also about navigating a complex web of social, financial, and psychological challenges. And at the heart of these challenges are the mental health issues that so many older adults face. Clearly, the aging population in India faces unique mental health challenges. Psychological disorders related to aging. But what specific psychological disorders are related to aging? Aging is a natural process that brings about many changes in a person's life, and among these changes, psychological disorders are a significant concern. 3 common psychological disorders related to aging are depression, anxiety, and dementia. Depression is not a normal part of aging, but it's more common in the elderly than in other age groups. It's often overlooked because its symptoms, such as fatigue, irritability, and loss of interest in activities, can be mistaken for the normal signs of aging or physical illness. However, depression in older adults can significantly affect their quality of life, and even increase the risk of physical illnesses. Next, we have anxiety. Like depression, anxiety is not a normal part of aging, but it's more common in older adults. It can manifest in various forms, such as generalized anxiety disorder, panic disorder, or specific phobias. Anxiety in the elderly can lead to social isolation, physical health problems, and decreased quality of life. Then there's dementia, a term that covers a range of conditions affecting cognitive abilities. Alzheimer's disease is the most common form of dementia, and it involves problems with memory, thinking, and behavior. As dementia progresses, it can significantly impact an individual's ability to carry out everyday tasks, leading to a loss of independence and significant changes in personality and behavior. Each of these disorders can significantly impact an individual's quality of life, affecting their ability to enjoy their later years. They can lead to social isolation, physical health problems, and even a shorter lifespan. And these are just a few examples. There are many other psychological disorders that can affect older adults. Importantly, these disorders are not an inevitable part of aging. There are effective treatments available, including medication, therapy, and lifestyle changes. Early detection and treatment can significantly improve an older adult's quality of life. As you can see, aging can greatly increase the risk of various psychological disorders. It's crucial that we understand these risks and work towards early detection and intervention to ensure that our later years are not just longer, but also healthier and happier. Factors contributing to mental health issues in the elderly. But what factors contribute to these mental health issues in the elderly? This is a question that begs a nuanced understanding of the complexities of aging. Let's start with physical health problems. As we age, our bodies naturally become more susceptible to illness and disability. Chronic diseases, such as heart disease, diabetes, and arthritis, become more common. These physical ailments often go hand in hand with mental health issues. For instance, a study showed that about half of those with heart disease also have depression. The constant management of these chronic conditions can lead to stress, worry, and ultimately, mental health problems. Loss of loved ones is another significant factor. As people grow older, they inevitably experience the passing of friends and family. This loss can be incredibly distressing and can lead to feelings of loneliness and isolation. Bereavement, particularly the loss of a spouse, can trigger severe depression, especially if the person left behind had been heavily dependent on their partner. Then we have lifestyle changes. Retirement, while often seen as a time for rest and enjoyment, can also be a time of stress and adjustment. Many elderly people struggle with the loss of purpose and routine that a job can provide. This can lead to feelings of worthlessness and depression. Additionally, the lack of social interaction that often comes with retirement can contribute to feelings of loneliness and isolation. Moreover, elderly individuals may also face issues related to financial instability or housing, which can create a sense of insecurity and anxiety. A lack of adequate social support or perceived stigma about mental health issues can also act as barriers to seeking help, exacerbating the problem further. Lastly, it's important to remember that aging itself can bring about a sense of existential dread. Thoughts about mortality, the meaning of life, and regrets can weigh heavily on the elderly, leading to anxiety, depression, and even suicidal ideation. These factors can all contribute to mental health issues, making the elderly particularly vulnerable. Understanding these factors is the first step in addressing the mental health needs of our aging population. The growing needs of older adults in India. So, what does this mean for the growing needs of older adults in India? As we delve into the subject, we must acknowledge that India is home to a rapidly aging population. With this demographic shift comes a set of unique challenges that need to be addressed to ensure a good quality of life for our older adults. One of the most pressing issues is mental health care. The prevalence of psychological disorders among the elderly is alarming and, unfortunately, often overlooked. Hence, there is an urgent need for comprehensive mental health services tailored to this age group. In addition to mental health care, social support plays a significant role in the well-being of older adults. Loneliness and isolation can exacerbate mental health issues and negatively impact overall health. Therefore, fostering a strong support network through family or community-based initiatives is essential. Financial stability is another pillar that cannot be ignored. Many older adults in India face financial hardships, which can lead to stress, anxiety, and depression. Ensuring a secure financial future for our elderly is a societal responsibility we must all share. Lastly, we must remember that our older adults are not just recipients of care, but also reservoirs of wisdom and experience. Recognizing their potential contributions can help in creating a society where every individual, regardless of age, can lead a meaningful and fulfilling life. Addressing these needs is critical to improving the lives of the elderly in India. The role of psychologists. But what role do psychologists play in all of this? Let's delve into it. Psychologists are the cornerstone in addressing the mental health needs of the elderly. They play a multifaceted role, providing not only therapy, but also assessment, diagnosis, and treatment of various psychological disorders related to aging. They are the ones who understand the intricate connection between the mind, the body, and the environment, and how these factors interact as we age. Their expertise is invaluable in identifying mental health issues that may be overlooked, misdiagnosed, or misunderstood. They are skilled at distinguishing between normal signs of aging and symptoms of more serious mental health conditions. This ability is crucial because early detection can lead to more effective intervention and better outcomes for the elderly. But psychologists do more than just diagnose and treat. They also advocate for the elderly, promoting awareness and understanding of the mental health issues they face. They fight the stigma that often surrounds mental health in older adults, making it easier for them to seek help. Furthermore, psychologists provide support to family members and caregivers, teaching them how to cope with the challenges of caring for an aging loved one. They offer strategies for managing stress, dealing with difficult emotions, and maintaining a healthy relationship with the elderly individual. Finally, psychologists contribute to research, advancing our knowledge of aging and mental health. They help develop and refine interventions to improve mental health outcomes for the elderly. As we can see, psychologists play a crucial role in addressing the mental health needs of the elderly. Key points. So, what have we learned today? We've delved into the intricate connection between aging and mental health, uncovering how it's not merely a linear relationship, but a complex web of interdependencies. We've looked at a case study, shedding light on the harsh reality of psychological disorders that often accompany aging. We've also explored the various factors contributing to these mental health issues in the elderly, from societal pressures to physiological changes. India, with its rapidly aging population, faces unique challenges in meeting the growing needs of older adults. Psychologists play a crucial role in this scenario, not just in treating disorders, but also in raising awareness and advocating for policies that support mental health in older adults. As we continue to age, understanding these issues becomes increasingly important. After all, mental health is just as important as physical health at any age. And if you like this video, do not forget to subscribe to the Psychology and Physical Training channel for more videos. Thanks for watching.